Thank you all. As you all know, that International Forum for Promoting Homeopathy is conducting regular sessions, and we have 3 sessions in a row. 7 to 8, our Hindi session, 8 to 9, the international session in English, and 9 to 10, we have a local language session in Malayalam. So all these things are happening for the last 1,388 days, and we are very happy to say that we are having such wonderful personalities from different parts of the world. Our homeopathic lovers, homeopathic doctors, and students are all participating in the session. We are uploading every presentation on the very next day itself so that you can watch again and again, and you can share with your friends so that homeopathy will reach at every home. This is the purpose of International Forum for Promoting Homeopathy, to promote homeopathy by all means. And today, our guest is Dr. Sumana Kumari Pandey, MD. She is the retired District Medical Officer, Homeopathy, Cuttack Circle, Healthcare and Family Welfare Department, Government of Odisha. She is a consultant in Davaneshwar Homeopathy Clinic, Cuttack, Odisha, and she has an experience of 35 years in treating chronic cases of all type, and specifically obstetric and gynecological cases, palliative care of cancer cases at the Minister Homeopathy Clinic. And she has a teaching experience of 18 years at the Department of Medicine Medica at Dr. Abhin Chandra Homeopathic Medical College Hospital, Bhubaneswar. She is a person who has worked as a worked as the principal investigator in collaboration of research project from CCRH, Government of India, efficacy of homeopathic therapy, duration of the labor, etc. And she is a resource person, and she has presented so many scientific papers in peer-reviewed journals like L LRHS and PubMuted, etc. And she is a winner of many awards. There is Best Homeopathic Award of Orissa, the Handyman in Private is summoned in 2014 by Homeopathic Board of Odisha. Best Homeopathic COVID Barrier by Mayavadi Mahila Samaj, Women's Inspiration by Lions Club, Best Women Social Worker by Odisha, Nari Seva Sign Cuttack Branch, Bharat Homeoretna by Wilson Homeopathy, and served through Lions Club International as well as a disabled diabetic chairperson to create diabetes awareness throughout Odisha and received most prestigious international presidential medal in 2018. And Dr. Sumana Kumari Panda has presented so many sessions in our row. And she has talked about the infertility and obstructive tubular problems, etc. When today, doctor will be discussing about management of infertility due to hypothyroidism with homeopathy. This is a very, very important session because hypothyroidism itself is a very difficult thing to manage, and then naturally that become a cause for this infertility. Then that will be a troubleshooter for many of us. So let us welcome proudly our guest of the day, Dr. Sumana Kumari Pandey, to this session. Welcome, madam.
Namaste. Thank you, Dr. Danesh, for a beautiful introduction of me. Thank you. And at the outset, I am very much grateful to my teacher, Dr. M.K. Shanisha, and the whole team of IFPH that they have given me a chance to speak over here and to present my cases. So today is my topic. I'm sharing my screen. So warm welcome to everyone. Really, as Dr. Dhanesh said, this is a very important and a very important topic, vital topic, and nowadays every physician is facing such problems. Infertility due to hypothyroidism, due to hyperprolactinemia, due to hyperandrogenemia, associated with the PCOS. So all these things are trending a lot and trending high. So we have to work on that
And madam, can you share the
Yes, yes, I am sharing my screen.
already it is not visible for us. So if you have not shared, please restart.
Yes,
Yes, yes, now it is clear.
visible.
Yes, yes,
Yes.
we can see everything fine. We can go ahead.
So my topic today is management of infertility due to hypothyroidism with homeopathy evidence based. So motherhood, all love begins and ends there. Such a nice talk, the motherhood. And every woman after marriage, the theme of marriage is that to for growth of a family. Every woman wants to be a mother, and the motherhood gives extreme pleasure to a lady. So, but unfortunately, some of them suffer from infertility. And nowadays it is in higher trend. Various factors are there. Uh, Among them, the lifestyle, the late age marriage, the sleep disorder, dietary disorder, and the lack of exercise, inactivity, stress. So all these infection, so all these things are trending high, and infertility is in a higher percentage nowadays. If we will see, just 20 years back, we were getting hardly one case in 2 to 3 months like that in infertility. But nowadays, every week, I think we are getting a new case of infertility in our clinics. So it is in a higher trend. Not to say about the gynecologists, they are getting so many cases. So coming to the next slide, infertility and hypothyroidism. If we are discussing to the cases of PCOD, nowadays it is in higher trend also, and that most of the time PCOD converted to PCOS when it is associated with hypothyroidism, either or hyperprolactinemia or hyperandrogenemia, and subsequently in the long run we find the anti-Mullerian hormone level decreases, which confirms about low fertility. So we have to avoid that. Various factors, not only, I will not say only with the medicine, these cases can be cured. Medicine along with lifestyle management is highly essential. The sleep habit, the dieting habit, the exercise, weight reduction, mind relaxation, along with the homeopathic constitutional remedy are the answers to infertility associated hypothyroidism. So thyroid disorders are the most common endocrine problems in women. In most of the cases, thyroid can lead to infertility or miscarriages. The etiology of infertility is multifactorial, with thyroid disorders as the most common presenting factor nowadays. Nowadays, the girls are coming. Usually, we in my clinics, I have seen PCOS case. The lady of 28, 29 years, and the weight is about 100 kg, 120 kg, 125 kg, 90 kg, like that, which were I had not seen before 15, 20 years like this. So in these 15, 20 years, a great change has come. So this is actually a headache for all the doctors to deal with the endocrine disorders associated with infertility. The etiology infertility is multifactorial, and with thyroid disorders as the most common presenting factor, hypothyroidism in particular. Infertility in women can lead to emotional and a psychological stress. The study says the psychological stress excites hypothyroidism, and hypothyroidism leads to mental stress. So in both way, we find these things. Undiagnosed and untreated thyroid disease can be a cause of infertility as well as subfertility. What happens? Thyroid dysfunction can affect fertility in various ways, resulting in anovulatory cycles. What happens? It causes anovulatory cycles. Thyroid hypothyroidism excites a hyperprolactinemia, causes hyperandrogenemia, luteal phase defect, and sex hormone imbalance. Subsequently, the estrogen progesterone level imbalance occurs in due to hypothyroidism. So therefore, normal thyroid function is necessary for fertility, pregnancy, and to sustain a healthy pregnancy even in the earliest days after conception, because hypothyroidism may cause the miscarriage, abortion, preterm labor, and so many problems are coming due to hypothyroidism during pregnancy also. So coming to pathophysiology, the amount of thyrotropin releasing hormone from the hypothalamus markedly increased by inhibition of pyroglutamyl peptidase 2. This is the enzyme which catalyzes TRH. The increased TRH in hypothalamus causes increased thyroid stimulating hormone secretion and prolactin secretion from pituitary. And this increased TSH leading to infertility. Because when TSH is increased, then T4 level reduces. The thyroxine secretion from the thyroid gland reduces during in hypothyroidism. In hypothyroidism, we find the reduction of thyroxine secretion or T4 secretion from the thyroid glands, which ultimately affects the sex hormones and causes the anovulatory cycles. So this is the study. Again, another study also we find that the prevalence of International Journal of Applied and Basic Medical Research in January to June 2012 states that prevalence of hypothyroidism is 2 to 4% in women in the reproductive age group. And they have taken a study, and the result of the study is out of 394 infertile women, 23.9% were hypothyroid. TSH is greater than 4.2 mu international units per ml after treatment for hypothyroidism. 76.6% infertile women conceived. And here also they have taken that the infertility is a worldwide health issue affecting approximately 8 to 10% of the couples worldwide. And in India, we find the WHO estimates the overall prevalence of primary infertility in India to be 3.5 to 16.8%. So it is not a small number. It is quite a remarkable number. And thyroid dysfunction is more common in females 4 to 5 times than in males. Prevalence of hypothyroidism in the reproductive age group ranges from 2% to 4%. So this is the study they have undertaken, where that is also concluded that hypothyroidism causes infertility. So first coming to case. I came to case 1. First case, a 26 years lady approached for primary infertility of nearly 2 years. On 24th July 2023. She had regular menses, 24 to 27 days interval and flow for 4 to 5 days, but with copious flow. Dysmenorrhea, pain lower abdomen before and during menses. Aggravation before and during menses, she had pain, bearable pain, scanty flow in July cycle. But previous cycles were copious, profuse flow. In this particular July cycle, she had scanty flow. She had menarche on 11 to 12 years and her LMP was 23rd July 2023 and she approached me on 24th July 2020. Next complaint she had leukorrhea, albuminous, stains the linen before menses, leukorrhea aggravated, and the next complaint was swelling of right foot, aggravation working with water for long time, and the other complaints were soreness of heels, shoulders, metatarsal joints, aggravation rising after sleep, coolness sensation in stomach, aggravation fried food, eating after for long hours. In past history, we won't find anything remarkable. In family history, also not very remarkable. Her father had hypertension. She was a housewife. And next coming to, she was under the treatment of allopathy with a hormone replacement therapy for some months. But with that, she didn't conceive. That's why she was referred to me. So coming to the physical generals, we find she was susceptible to cold but very ambithyous. Desire for sweet was there, aversion to bitter, but here the remarkable thing was thirst was less, 1 liter per day with moist tongue. And coming to mental generals, she was very short-tempered, can't tolerate contradiction, egotism was there, very prestige conscious, not very sociable because due to egoistic nature, she was thinking that why I will be so much sociable, why I will talk to her, why they will not ask me for everything, why I will ask them to the in-laws for everything, like that. So apprehensive for any criticism, and she was very fearful that anybody may find out her problems, her loopholes, so that they will criticize. That's why better to avoid talking to others. So sluggishness in work, she was very sluggish, as informed by her husband, but she was very responsible. Those sluggish, egoistic like that, but she was taking care of her whole family, her in-laws. She was doing all cooking activities, everything. So with this, her height was 157 centimeters, weight 64 kg, and BMI was 25.96. So she was counted under overweight. So basing upon this, I went for categorization and I went for Calcira carb 203 doses 1 hour. That the copiousness, the menses were 24 to 27 days cycle with copiousness of the flow and though not protracted, the patient was very sluggish and all the complaints are aggravated while working in with water for long time and very short tempered like that. So with this I went for calculator. Obesity was there, overweight, and followed by placebo 30. Next, she brought me on 14th August, near about after 1 month, not 1 month, 20 days, 22 days after, she brought me these reports what I had advised to do. She brought me the TSH level was 6.7. The normal is 0.5 to 5.5, but all the studies says that in this age, in the within the age of 30-35, if the TSH level is within 3 to 3.5, that's good. And some studies, some research study also says if it is within 2.5, that's very good. But here it was, TSH was 6.7. And her testosterone level also was so high, 8.4 to 48.1 is the normal range, but she had 48.46. And AMS was a satisfactory fertility. Anti-Mullerian hormone was good. Insulin postpartum insulin was also good. RBS was good. Hemoglobin was also good. So with this, no problem. Only test she had hyperandrogenemia. The male hormone was increased and the TSH level was increased. And we can term it as hypothyroidism. So again, I went, no marked improvement was marked within 20 days. So again, I went for Calcarea-Car 1M 3 doses, 1 hourly, placebo 30 once daily, along with thyroidinum 3x twice daily. So with this, I continued, and this is the report. I will show you the report. So this is the no. This is after treatment. All the reports are here. So this is the report. Thyroid stimulating hormone was 6.7. And testosterone report is also here. Due to really lack of time, I couldn't place it inside the PPT. How to come? Okay. So this is the report, and the testosterone also was more. So next I followed on 30th August 2023. No cold attack in between, others as before. But that time she has not disclosed one thing, and I also has not observed that the excessive hairs on lower limbs. She had as hyperandrogenemia in high testosterone level we got in the pathological report, and again excessive hairs on lower limbs like male pattern also I find with that lady, and laziness but physically but very dutiful. She was very not so sluggish. What I observed that she is not sluggish, she is active, but she is very lazy. If he wants to work, then she acts uh, with the agileness, but activity. But most of the time she is very lazy. But simultaneously she is very dutiful, very responsible for in-laws. That's why she was conducting all the homeworks, all the houseworks, kitchen works, though she had no interest for that, though she has no interest to all these things, but simultaneously she is uh, sensitive and she is dutiful. That's why she does, or she was doing all those things for her in-laws. So in this aspect, we will find the beautiful. When we are thinking of, we will find Calicar, nitric acid, and Calcarea-Car. But no sense of duty also we find in Calcarea-Car simultaneously. But excessive hairs on lower limbs, when I went for that, I didn't found Calcarea-Car in a higher grade. So next I found that by analyzing, I found that the patient was more interaction. So I found the greediness was there, indifferent to everything, and specifically indifferent to family members. She was very indifferent to family members because she was lazy and she doesn't want to work. But simultaneously, as she is dutiful, she has to work for the family members. That's why she had no emotional attachment towards the family members, but she was doing all the works. Less emotional attachments, but duty concerned. So indifferent to duties we find in Calcarea-Car, but she was very duty concerned. That's why she was, though she was lazy, but she was doing all the works because of only duty concernedness. That's why I thought this is not Calcarea-Car. I have to think of something else. And in this case, I find the greediness we find in lycopodium, sulfur, arsenic, sepia are the drugs. In and excessive hairs on lower limbs, there also we find the natremure, sepia like that. And in a report also we find the male hormone androgen is more. If we will go through the essence of mathematical biology or physics, we find the lady having male-like characters under sepia. So, thinking of all these things, I went, instead of calciracar, I went for sepia. Sepia 1 m 3 doses 1 hourly, followed by placebo, and simultaneously I was giving thyroidinum 3x BT. On 16th September 2023, just last year, she is continuing further treatment. So leukorrhea relieved, menses regular, flow for 6 days, 3 to 4 pads per day, and others as before. Weight, but she reduced weight 60 kg. So she was, I advised her, I counseled her for a regular sleep habit, for yoga, meditation, to avoid fast food, to avoid fatty food, deep fried food, sweets like that, and she obeyed me and she reduced her weight 6 to 60 kg. Again, I went for sepia 1 m, 3 doses 1 hourly, followed by placebo and thyroidinum 3x. On 2nd September and 2nd October 2023, joint pains improved. She had joint pains in first visit. I had marked aggravation by working in damp places in cold water, but pain lower limbs aggravated cold from. Weight was same 60 kg. I went for sepia 10 m, 1 dose, followed by placebo and thyroidinum 3x. On 18th December 2023, in just before 6 months, she came with pregnancy test positive. Her LMP was 8th November 2023 and her TSH level reduced to 3.88. 3.88 or this is the TSH level 3.88 on 5th January 2024. She brought me the report that thyroid was TSH was 3.88. And now, and she brought me these reports. This is the ultrasound report. I referred for a ultrasound and advice, and she brought me the single live fetus of 13 weeks, 3 days gestation. Okay, on, so date is not mentioned here. Report date 18th February 2024. 18th February 2024. And next report also, she brought me this ultrasound report about the biometry of the fetus. Here you will find that a single live fetus of 21 weeks, 5 days gestation in vortex presentation. So now she is continuing with me. The constitutional remedy is continuing. She is continuing with me. So pregnancy positive. Her husband was oligospermia, and I continued homeopathic constitutional remedy for that, and with that she conceived. Now she is continuing her pregnancy about 8 months, I think, or 30 weeks, 32 weeks, like that. and everything is good, nothing wrong with her. So next coming to the second case. I must mention that in first case, for hypothyroidism, she has not taken any hypothyroid drainage, thyroxine or any allopathic drug during that period, during our treatment. Only with homeopathic constitutional remedy, along with thyroidinum 3x, she conceived and she is continuing her pregnancy very well. No other drugs still administered to her. And iron calcium, we are supposed to, we are giving the iron tablets. I am giving the iron tablets. The calcium in diet, mostly milk, and if needed, I am giving calcium. If needed, I am giving the vitamins. All these things also supported. The and all antenatal checkups are in our clinics only, in the Dhabaleshwar Homeo Clinic, and everything is with us till today. So next is case 2. This is a second case of primary infertility of 3 years with acne, papular eruption on face for 5 to 6 years, reddish, sore, aggravated menses before, menses regular, scanty, no dysmenorrhea. Recurrent cold attacks she had, sneezing, sore throat, headache on temples, aggravation from heat, summer, running nose, aggravation, change of season. So, in family history, parents had diabetes mellitus. Physical generals, she had desire for salt, too much sour, and aversion to milk. Stool was soft on alternate days. Sweat was profuse. Weight 67 kg. BMI was 26.86 and blood pressure quite normal. On 1st October, she was coming to mental generals. She was very introvert, desires to be alone, talk indisposed to, fear of most of the animals, cows, dogs, cat, insects, so monkeys, all animals. Anxiety about health issues, angers easily due to more work pressure, because she was a service holder lady and the job along with the household works were putting her over exertion. So, and basing upon the physical generals and mental generals, I went for Natramine 200, 3 doses 1 hourly, followed by placebo, and advised the tests, pathology. So, next on 1st October, she came improving, acne improved, but aggravation menses before. So, all the time she had acne, but aggravation menses before was there, painful menses with nausea and bearable pain. Weight 67 kg, same. TSH she brought me 17.73, thyroid stimulating hormone. Hemoglobin was normal and fasting plasma glucose was normal. Again I went for Natramure 1. So we must see the TSH level. See, you can find on 23rd September, is it visible? Hello?
Yes, yes.
Okay, okay. So TSH level was 17.73. Okay. So 23rd September 2017. So again I went for Natramure 1M 2 doses, 1 hourly and repeated after 15 days. Placebo 30 followed by thyroidinum 3x. Really my experience I have found for so many years. In case of hypothyroidism, thyroidinum 3x is acting very well along with the constitutional remedy and along with the lifestyle management. So next, on 2nd November 2017, acne again too much aggravated before menses, painful menses with nausea, bearable pain, weight 64 kg. So acne, all other complaints were not there. So natriumur 200 improved body in 1 m, the acne aggravated, and that was before menses. So as a basing upon these mental symptoms, that introvert desires to be alone, talk indisposed to fear of animals, and overexertion. She was continuing her study, all these things. Exhausted female, but working sincerely and dutifully. She might have avoided that. She might have told that I can't do the household work, I can't prepare food for my in-laws or family members because I am working, I am busy. But she didn't did like that. She worked. So basically, but she had no interest with that. She had no attachment to that work. Okay. She was doing for everyone, but she had no attachment to that. So basing upon this thing, I again, as a complementary drug, follow-up drug of natriumur sepia, I went for sepia 1 m 2 doses, 1 hourly, and repeated after 20 days, followed by thyroidinum 3x. Again on 18th December 2017, acne reduced before last cycle and painful menses, bearable pain, no nausea. She reduced her weight to 62 kg, 5 kg reduction. Again, she brought me at that time the TSH report, which was 17.73. Now it reduced to 3.39. Rajashree Panda. So 17 December 2017. So she brought me this report that TSH level reduced. And next I went for sepia 1 m again with thyroidinum 3x. And on 18th March 2017, she sent her husband to me with the urine test. She had gone for the urine gravidex test with the slide. With that slide, she can send her husband to me that with the pregnancy positive. And she, according to the LMP, she had a 7 weeks pregnancy. And sepia 1 m 2 doses 1 hourly prescribed with thyroidinum 3x. But she didn't came to me after that. She is staying far away from my place. That's why she's communicating me over phone if needed, and she is continuing her treatment in just nearer to her village in a allopathic hospital. Now she is continuing her treatment for pregnancy. But she became pregnant with a hypothyroidism with a sepia and a thyroidinum 3x. Okay. So that was the second case. Now I will go for a third case. A lady aged 28 years presented on 9th March 2018 with following complaints. So she had a secondary infertility of 4 years. She had one son of 6 years, and after that had cesarean section in last 2012. After that they have given some gap, and next for last 4 years they were trying, but no fertility. Menses irregular, copious flow, dark, pain in abdomen, aggravation during menses. She had leukorrhea aggravation before menses, and she had unusual milk secretion from both the breasts. Unusual excessive hairs on chest and legs, frontal headache, nausea with fainting attacks, aggravation, heat, exposure to heat, relieved by rest and induced vomiting. So unusual milk secretion was it, later on it came to my notice that that was due to hyperprolactinemia, and she had excessive hairs, little bit hyperandrogenemia also she had. So in this situation, she approached us in my clinics, Dr.SUMANA Homeo Clinic, Cuttack. So physical generals, hot patient, desire for sour milk and spices. Under mental generals, really this case was very interesting. I took a long time to find out these symptoms. And I have taken the case history. Most of the cases in infertility, that was our habit to take case history of both the partners, male and female. But as the male partner was not hypothyroid, that's why I am not presenting his case today. Only female I am presenting. So, but we treat both the partners. Might be seminal test any disorder or might not be. But still then we are giving constitutional remedy to both the partners. That is our style of prescription. And we give the counseling for lifestyle management to both the partners. And in this case and case taking we do separately for male and for female to maintain privacy so that they can come out. Okay. So in this case, the physical generals, hot patient is just sour milk and spices. Mental generals, angers easily, beats her own head on wall, shouts during anger, too much stressful with grief. See, angry up to so much extent. Too much stressful with grief. Sexual passion has increased. Sexual harassment by husband as husband has no desire for sex. So she was living in a joint family with in his family, his husband's elder brother and his wife also they were staying. They were very romantic, but her husband was not so romantic. That is the point where she became disappointed and her anger increased, her grief came as she underwent the sexual harassment as her husband has very less desire. He was very timid. He was very timid in nature. So the lady was very jealous to the other one. The brutal from disappointed love with rage. Okay. Suicidal thoughts came to her by hanging or poisoning. See how much depressed, how much disappointed she was due to this. She was very quarrelsome and she has taken already allopathic and homeopathic medicines. These were the reports, the lipid profiles were very normal and insulin, fasting insulin was normal. Testosterone little bit 30 to 95 of course the range and she had 56.8, not so much, but we observed the excessive hairs on the lower limbs we have found that. And here we find TSH level was 84.7. See, too high. That should be within 3.5. I told you the research study says in this age that should be within 3.5. But she had 84.7 TSH level in 9th March 2018. And her weight was 76 kg, BMI was 32. So again, obese. She is not. She cannot be counted under overweight. She is already because 30 plus is obesity. Husband had normal seminal analysis and normal TSH. I took the rubric mind jealousy brutal from jealousy gentle husband becoming. 4 drugs are there: calcareacar, lachesis, nox vomica, and sulfur. So basing upon other symptoms, you might have seen that very quarrelsome, jealousy, and the sexual passion is increased. So suicidal thought comes, very angry. So basing upon all these things, though the unusual milk secretion is not covered under lachesis, but basing upon the mental symptoms, I went for lachesis 1M, once, and basing upon this rubric specifically, calcarea curve is sluggish, he was not so sluggish, and Nox vomica is very perseverance, very obstinate, very workaholic, like that. She was not like that. So that's why I went for lachesis 1M once in 15 days, followed by thyroidinum 3x. And the next visit she brought me, the TSH level was 18.79. And next, this is the report she brought me, that is the TSH level was 18.79 on 4th July 2018. See, this lady 74.072, that reduced to 18.79 with lifestyle management, homeopathy constitutional remedy along with thyroidinum 3x. No other medication was done. No thyroxine given, no allopathic medicines given, nothing else given. So with this only she improved her, and in next visit she brought me the milk secretion reduced, headache occasional, and weight reduced to 60. See, 76 kg to next visit 65.7 kg. So how much lifestyle for lifestyle management, how much yoga she had continued along with us. I had continued with her counseling. So with that she improved, and followed by again I went for lachesis 1M1 dose, but she didn't conceive. That's I went for once daily for 1 week, iodome 30 followed by alpha mother tincture. In a first December 2018, 1st December 2018, after 3 months, again she came with the LMP, was her last menstrual period was on 23rd August 2018, and vomiting for 4 to 5 times per day, and the TSH levels she brought me 3.66 with the ultrasound report of pregnancy. You can find out prolactin. You can find this report is on 28 October 2018 she had 3.66, but in December she brought me this report 3.66, PSS 3.66, and this is the ultrasound report she brought me because she was staying 200 kilometers away from my clinics. So she brought me on 23rd October. Again, she had gone for this ultrasound report. Intrauterine gestation with a single live embryo of gestational age of 8 weeks and some 5 days. 8 weeks, 5 days. So this she brought me this report, and I also have her photograph, but as Dr. Danesh really time was too short, that's why I couldn't find that. She is having now, she is having another, she is having a daughter. Previously she had a son. Now she is having a girl child. Normal delivery was there. So natural remedies, time is short. I will finish within 1 minute. Natural remedies for hypothyroidism. We know hypothyroidism occurs due to iodine deficiency. The normal need for a person, everyday need is 150 mu gram per day iodine is needed, and we can find the natural sources like selenium rich foods, sugar free foods, gluten free diet, vitamin B supplements, and probiotics like yogurts, dosa batter, like that we are using. Fruits like apple, pineapple, cranberry, strawberry, etc. we can advise. Iodine containing foods such as seafood, dairy products, eggs, etc. But too much use of iodized salt is not advisable in hypothyroid cases. because the that also creates problem. We can take iodized salt, but iodine in if we are roasting, then that is less the uh, iodine percentage reduces less. But if we are cooking through a pressure cooker, that way that reduces 17 to 66%. So too much reduction of iodine occurs with that, but too much iodine is also not advisable. That's why we can advise to hypothyroid cases, take iodized salt for 1 to 2 months, then take non-iodized salt for 2 3 months, like that. Again, you take iodized salt, like that. So we can advise like this to the hypothyroid cases. Stress is a major factor which also causes, many studies are there. We have to reduce stress and obesity. Weight reduction is mandatory, and stress reduction through meditation, through becoming happy, through dancing, through going outside. So this is advisable in case of hypothyroid. Treatment plan: psychological interventions, cognitive behavioral therapy. Viable pregnancy rates were 55% for the cognitive behavioral group, 54% for the support group, and 20% for the control by the DOMAR study 2000. So, exercise, regular exercise, weight reduction programs, personal hygiene, balanced diet, and here I should mention that a sound sleep. Sleep habits should be maintained. And along with homeopathy constitutional remedy are the main treatment plan. So, conclusion: it's better to light one candle than to curse the darkness. Life is precious, treat with utmost care. Well, mostly infertility with hypothyroidism is really very difficult to treat without any thyroxine, without any allopathy treatment. Because when we are giving thyroxine, the artificial hormones, in the beginning of hypothyroidism, in those cases we are wasting the case, because in the beginning the thyroxine level is not so less, TSH level is not so high, but if we are giving artificial thyroxine through modern medicine treatment, then the natural thyroxine secretion automatically will reduce to a remarkable degree. So, because due to the stage of inertia will appear. So that's why to avoid those state, we have to go for the homeopathy constitutional remedy along with the lifestyle management, stress relaxation, all these things. So this will be, though the uh, all the cases we can't cure, but if we can make even some cases of infertility to fertility, non-motherhood to motherhood, we can bring smile in a dry face. So that is very important. That will give us satisfaction. So this is all about my presentation. Thank you for patient hearing.
Thank you, Dr. Sumana Kumari Panda. It's really a very good session once again. And you have shown the three cases. All the cases were really brilliant because curing the incurable is something great as well. That's what I have to say about the session. Usually, people may find it very, very difficult to have to become a mother of a child when they have both these things together. But with homeopathic treatment, we were able to make them a healthy family, happy family. That's what I have to say. Add something more about your presentation. That in the first case, you find that it is a case of calcarea car, but later, when you find it that the expected result is not getting, then you shift on to the other medicine, that is IPA, then that really works. But of course, once the constitution is willing to take the action from some other people, then that's the way homeopathy need to be looked into. When sometimes the action of another complementary remedy may be required in getting 100% success in that case. And of course, In all the cases, what we have seen that along with the constitutional medicine, you went up with the thyroid in 3x, and that really works here. Not only the patient got a child after treatment, but the thyroxine level, TSH level also went down to normal. That's what we have noted in the presentation. That means that your combination is really a winning combination, and anybody can choose such combination. That is a constitution plus constitutional remedy plus an organ remedy. That's why thyroidism can be called as an organ remedy, and the potency itself, the 3x, that really works. And this is what I am also following this kind of method in the treatment of these cases. Whatever be the case, along with if the patient is having this thyroid problem, then definitely that's the way I used to look into. But there are other doctors who still stick on constitutional remedy to correct these things, but that can be another way also. But anyway, congratulations for such a beautiful presentation in this forum. Now I invite some other people who want to have a discussion with you, or if you want to have a question with Dr. Sumana Kumari Panda, you can raise your hand. Now I invite Dr. Ramparisa sir to say something about the presentation.
Thank you, Dr. Dhaneji. Congratulations, Dr. Madam. Very nice case and very nice presentation. Describing infertility case, and select of remedy is a very beautiful select remedy. Julius mind, the third case, lacacy is a very good remedy. And every case select remedy is a very good way of line according to law of treatment, homeopathic constitution. Very nice presentation, Dr. Madam. Every presentation is very good. There are many 3 or 4 presentation and IFPH. Very nice presentation. Thank you, Madam.
Thank you, sir. Thank you.
What I have noted in this presentation is that mostly in those cases, we have some family issues or mental traumas, and those cases and dwelling remedies may come into the picture. But here, a different remedy, that is lacasis, come in the picture of one case, because that case itself is a lacasis case. So that means that if the case is a typical case of a particular remedy, we can stick on with that remedy so that we can win the case. And that's why Dr. Sumana Kumari Panda had such success rate in her PTs. She had treated so many. Doctor, how much of this much of successful cases of infertility with you? I think more than 1,000 or something like that.
Not like that, sir. I think 600, 700, 800 like that.
Oh, anyway, that's
I have not figured out.
But that itself is really great news, because getting such incurable cases into curable thing is something great. Anyway, now I invite Dr. Mas to say auto thanks to this session.
Sir, really one thing I will say, that
Yes.
most of the cases coming to us are after long allopathic treatment, where as I told you that the thyroid, the ovary are going to after going to a state of inertia, they are coming to us. And with the age of 37, 38, 40, now I am getting 2-3 cases, 41, 42 years. So it is very difficult in those cases to convert infertility to fertility. So that's why we are getting failure. Otherwise, if the case will come to us in right age and in the prior visit to a homeopath, then the success rate is very good in those cases.
Yes, exactly. Now I invite Dr. Mas to say vote of thanks to this session.
Okay, thank you, Dr. Thank you, Dr. Dhanesh. I'm listening from Malaysia. It's 11:30 p.m. in Malaysia now. On behalf of IFPH, I would like to congratulate Dr. Sumana Kumari for sharing 3 beautiful cases on infertility and hypothyroidism. This is very beneficial for the homeopathic community. Thank you once again. Hope to hear more cases from you later.
Thank you.
Tomorrow,
Thank you.
please wait. Thank you, Dr. Moss, and please wait. Tomorrow we will have a session on yoga. That means tomorrow is a World Yoga Day. We have World Yoga Day celebration here, and the welcome speech by Dr. Shaji Kurdiat, inauguration by Dr. Ismail Sayed. The chief speaker will be, the keynote speaker will be Dr. Babu Joseph, Director, Netaji Yoga Naturopathy Hospital, Kundimangalam, Kochi, and water thanks will be done by Dr. Kiranjan, and the subject will be Yoga for Health and Harmony. With that, thank you, Dr. Sumana Kumari Pandey, and those who attended the session, and hope all of you will be there with us tomorrow at the same time.